Britain could lift some lockdown measures by the summer rather than waiting for coronavirus vaccine, research suggests. A ray of hope for the world has come in early evidence from China showing infection rates do not appear to have surged despite people being allowed to travel again. However, experts told MPs that Brits will only be allowed outside again if the government made more virus tests available. They expect the outbreak here to peak in 3 weeks. British scientists are among those scrutinizing data out of the country where the pandemic emerged in Wuhan in December. The city has been in lockdown since January, but restrictions were loosened this week. It comes after separate study by Oxford University suggested many more Brits may have been infected but developed no symptoms. The optimistic modelling theory suggests the virus was circulating in the UK by mid-January, around 2 weeks before the first reported case here. If true, it would mean more than half of the population are likely to have had COVID-19 and be immune to it. China is ahead of all other countries in spread of the disease there has slowed significantly. Mass gatherings are still banned. Author Professor Neil Ferguson, of Imperial College London, who is advising the UK government, said, "This provides hope for countries currently in various levels of lockdown." It was not all good news though. A separate study warned that China can expect second wave of infections by August after it lifted restrictions in Hubei province. Peer-reviewed modeling published in the Lancet Public Health Journal found that delaying reopening schools and workplaces month until April would delay the second wave from hitting until October. Dr. Keisha Prem, of the London School of Hygiene and Tropical Medicine, said, "The measures the city of Wuhan has put in place have helped to control the outbreak. However, the city now needs to be careful to avoid prematurely lifting physical distancing measures, because that could lead to an earlier secondary peak." The UK is currently only testing 5th of the 25,000 daily checks promised by Boris Johnson last week and lags behind other countries such as South Korea, Germany, Italy and Norway. Professor Ferguson, who is recovering from COVID-19 himself, told MPs yesterday via video link that any lifting of restrictions would require widespread testing. Sir Patrick Vallance, the government's chief scientific officer, told MPs, "I wish we had more tests available." Professor Sharon Peacock, of Public Health England, admitted the 25,000 daily test total will not be hit until the end of April. Professor Ferguson expects transmission to be reduced in the summer months by 10%, 20%. The only long-term exit strategy from current lockdown is the development of vaccine, which could take between 12 and 18 months. The Coalition for Epidemic Preparedness and Innovations has said that it needs extra cash from governments for 8 vaccine candidates in development. But Professor Andrew Pollard, of Oxford University, told MPs, "I believe that 6 months is possible, but it needs lot of things to fall in place so that this process goes well." Sunitra Gupta, professor of theoretical epidemiology at Oxford, said, "We need to begin mass antibody testing to assess what stage of the epidemic we're in. The government has purchased 3.5 million antibody tests, which could tell if someone has ever had COVID-19, and they will be kept at centre in Milton Keynes, Bucks." Public Health England's Sharon Peacock told MPs that home antibody tests would be available in the UK within matter of days. She said small number of tests which give an immediate result would be tested in lab before being distributed via Amazon and Boots. The antibody tests will be simple finger prick test whereby drop of blood gives an immediate result, similar to urine on home pregnancy tests.